Care contact time is a tool that we have used once and we will continue to use that helps us to look at where nurses and support workers are spending their time during their shift, and as a result of that, what amount of their time is for direct patient care. And it looks at certain activities such as patient handover, meeting patients' hygiene needs and delivering of medicines, and looking at where we can improve the standards that we're currently delivering to enable us to spend more time with the patients.
Some of the stuff that we did wasn't an option on the care contact clock, so we had to put down what we were doing instead of using the options that are on there. It was also difficult to keep up with during the day because we were too busy doing patient care, so we had to go back to the clocks every couple of hours or so and fill them in and backtrack what we did instead of filling them in as the day went on. With the results from the care contact time, we're working with the staff nurses to reduce the time they spend on the medication rounds in the morning, evening and afternoon, to help and make sure that everyone spends more time doing patient care.
And then they've put break time there. Yeah, the comment that I got from the first member of staff that saw the patient contact clocks were, if you want us to spend more time with the patients, why are you giving us more paperwork to do, which takes away from us looking after the patients? But like I explained to them, if we don't actually accumulate information and analyse it, we can't make changes on the wards which will actually benefit the patients. When we started the clocks, the ward is quite busy and there's a lot of doctors coming and going, and there's not actually a lot of workstation space to actually put the paperwork out to start with. The charts, because the clocks were so small, that actually the documentation at times was quite illegible, and there wasn't enough space if it was actually quite a busy hour for them to actually document all the activities that they'd done in that hour. So we're not actually quite sure how we get around that, but I think the clocks are going to get redesigned.
There were not enough clocks for the members of staff that we have, and some of the clocks were filled in inaccurately.
Yeah, they actually made some of the codes up. So some of the codes they made up were some member of staff put PW down. So I said, well, what's PW? That's not a code, that's a patient wash. So I was like, no, well, that's obviously hygiene, isn't it? So actually you have to write hygiene for that, not PW.
So we came up with a solution, and we redo the clocks again, and then Jane, that's where you actively got involved.
Yeah, I had to do a night shift. I explained to the members of the staff how important it was to do them properly. So I had to actually tape all the charts on the main desk, and every hour I called members of staff to the main desk and we backfilled the clocks for that hour by hour. So actually we had an accurate reflection of the night shift. Although there was a reluctance to fill them in, they did have the actual best interests of the patients at heart, and that's what they were concentrating on.
Care contact time is important in healthcare setting, and it shows us how much time we spend with patients. For me as a nurse, it has filling the activity clock has actually shown me how much time I spend with my patient and how much time I need to spend more with them. We have implemented writing the notes at the bedside to increase the care contact time, because we know the more of it and the quality of it will increase patient care and outcome. So writing notes on the bedside, for example, there you pick up the problem and solve it instantly, thereby reducing the risk of patient getting more poorly and then facilitating timely discharge. So for me, it's a good thing.
Care contact time is a really important initiative here at UHCW, and I just want to thank all of our staff who have contributed to this important assessment across all of our wards and departments. It's really important that this programme is absolutely focused on improving outcomes for our patients, ensure that they get the most safest and high quality care each and every time within our wards and departments. The next steps are really important to me. I've always believed that the nursing midwifery care in this organisation is some of the very best that I've seen, and I want to achieve the commitment to deliver world-class wards and departments within our organisation. And Care Contact Time provides us with an opportunity to reflect and look at how best we deliver care and experience to patients within our wards and departments. It's really exciting that actually this will formulate part of the new World Class Wards initiative, So we can see greater and increasing amounts of time by registered nurses spent directly with our patients. It also provides an opportunity to improve communication with family and carers. It's also great to hear about the new development of the multidisciplinary app, because that for me is fundamental. Care delivery on wards and departments is very much about the whole team, and this opportunity using innovative technology will certainly make improvements in understanding that and making future changes.